Hello, everyone. Hello. My name is Dr. O, and welcome to Health Caring Differently, where this is the spot where we inspire diverse students to explore careers in healthcare. Tune in every Tuesday at 7 p.m. Eastern Time, like right now, right here, right now. And follow us on all our social media platforms to stay in the loop, gain valuable resources, and hear more about our next stream. So you can follow us to find out everything you need. But also, please do sign up for our newsletter because that's where the information is at. So the live is where the inspiration is at, but the newsletter is where we have information on diversity pathway programs into medicine and the sciences, scholarship information, and research opportunities for students. Feel free to drop your questions tonight for our guest in the chat during this stream, and I'll make sure to ask your questions. Now, today's guest, so I'm very excited, is Dr. Bolu Ogunyemi. Hey, my brother. He is a dermatologist, clinical associate professor, and that's brand new. He just got promoted and acknowledged for the associate level professor, and he's a former assistant dean of social accountability at Memorial University. He researches, he writes, and advocates in the areas of health policy, social accountability, medical education, and diversity and inclusion. Dr. Ogunyemi is a TEDx speaker and frequent keynote speaker, and has written pieces published in the New York Times, the Globe and Mail, and Huffington Post, just to name a few. Finally, he currently serves on the governance committee of the Canadian Medical Association, which we actually talked about last week. So, without further ado, welcome, Dr. Ogunyemi.
Hi, thanks for having me. So great to be here, and I'm happy to discuss with you and interact with other folks that are taking part tonight.
Yes. And I mean, like, technically the title for tonight, the show is Dermatology and Accountability. But to me, it's like we're talking about that melanated, melanin rich skin and that hair, and talking about all of those things that we need to think about as we get to how you have been health caring differently and in your practice, and how others can do that. So it's bringing in that vibe, that energy, that lived experience that we all have, hopefully into the field of healthcare. So I'm excited about this chat, and I'm excited to see the questions that might pop up in the chat that the students have. So, what we're gonna do, I'm just gonna go right in. We're going straight in, and I'm gonna ask you the question I ask all my guests.
Sure.
How are you health caring differently?
Well, you know what? I think health caring differently is really about, doing things differently for whichever kind of, specific situation we have in front of us. Social accountability is closely tied to health equity. So for me, health equity means kind of uh, realizing that people start from different positions and kind of getting them where they need to go. It might have to treat people differently to get them where they need to go.
Yes.
Make sure everyone has equitable care. So for me, yeah, I mean, healthcare differently. It's day to day, the clinical level. So I spend most of my time, seeing patients in clinic. It involves systems change, right? So not just your individual patients, but how the health system, kind of the local health system works. And then on a broader level, I think it also involves, policy change, advocacy. So, fortunately, I've had opportunities to work at all three of those levels in order to healthcare differently.
Yeah. And I mean, your work, for policy and thinking about change, you've looked at it from broad perspectives of, like population or issues when it comes to general students, like let's say in the field of medicine and thinking about our social accountability. But specific to dermatology, and the patients that you see, some of your work has focused on what is called in the literature skin of color. Can you speak a little bit about what that means, skin of color? I know some people hear it and they're like, "What?" So what does that entail?
Sure. So, I mean, I'll start with a very simple history lesson. So, dermatology as a medical specialty dates back to the 19th century in the UK, France, and the US. So, as you can imagine, those three countries in particular, uh, there wasn't a lot of immigration during that time, and if there was, a lot of it was from from Europe or Eastern Europe going to those areas. So, there were many folks with richly pigmented skin. So, when we defined dermatologic diseases, they were solely defined in people with light skin. So we're realizing that there are very important differences in the way that dermatologic diseases present, differences in terms of adverse effects for different treatments. And there are also cultural differences that can also affect how dermatologic diseases present and how, counseling and how you manage them. So these, really the interrogation of the origins of our specialty probably began in earnest or a number of decades ago. A lot of this work was done in the U.S. And some work in the U.K., France, and now in Canada. So we call a focus on diseases that present differently, that have important differences in treatment, and where cultural factors and counseling are important. We kind of call that niche ethnic dermatology or skin of color dermatology.
Right. Okay. Very, very cool. And I mean, it's interesting because there's lots of layers to it, right? I mean, there's representation in the field of dermatology because isn't it odd that, I mean, yes, the history is from the early 1900s, but we're in, you know, 2024. Like, you know what I mean? Even if this has been going on for decades, very early in the trajectory of the field, there should have been a recognition that a huge chunk of the world has quite a bit of melanin and an understanding melanin rich um, folks. But I think the lack of representation also, right, of particularly Black people and other groups in the field of or fields of Western medicine and dermatology certainly has played a role in that. I know in Canada, like, how many Black dermatologists are there? Isn't it like six?
Yeah, I think 6 or 7.
Right. And
Yeah,
I think pretty much, I don't know everybody. I think I know four. I'm not going to name them because they're going to be mad at me for calling them. I can say first names though. There's like Renee, Marissa.
Yvette.
There's, what am I saying?
There's me and Yvette.
That, yeah, those are the
Yeah,
ones. You are the four that I know. Then there's
that's
two
right.
I don't
Yeah,
know.
the four of us are pretty close.
Yeah.
The four of us are the majority. So
Yes.
whenever we get together, we are the majority of Black
You're the
derms.
majority,
But
and you're the ones that I know, but all of you do skin of color. I think that is also interesting, right? That's what we're talking about. Representation matters, right? So it's fantastic, the voices and the perspectives that you folks are bringing into the field. You're not the only folks doing work around skin of color, but
that's
out
right.
of the few Black dermatologists that there are, either all of you or most of you certainly are. So I think that's amazing and makes me wonder about your journey.
Hmm.
Um,
Well,
so
yeah.
go ahead. No, go on.
I mean, it's journey. You mean more in kind of medicine or in dermatology in particular, or
You can take it wherever you like it. But I mean, we have young folks, who are largely thinking about medicine or in
okay,
for
okay,
first or second year medicine. So
oh,
your
okay,
journey and
okay,
some of the
okay.
challenges, right? So
Okay.
talk.
Well, I mean, I think certainly any health career, whether it's medicine or the health careers, are very rewarding. I think it's both a responsibility and important privilege to be able to help people in health. So whether it's medicine or other health fields, whether you're a family medicine specialist or a specialist in another field. For me, part of the reason I chose dermatology in particular, I actually specifically wanted to be a dermatologist that had a focus in skin of color dermatology. So I have a background in sociology and medical sciences. I did a double major at Western University. So I always really appreciated the art kind of hand in hand with the science of medicine. So I understood early, kind of the reason that skin of color dermatology was underrepresented. I noted that it was getting a lot of traction in the US, but I thought that Canada, had a lot of space to go. So I actually, in terms of this in particular, so Yvette and I wrote the first article in Skin of Color Dermatology in Canada in 2017. And actually
Hey,
yeah, it came full circle because
uh-oh. We just lost.
dedicated
Oh, sorry.
dermatology.
We lost you for a second. You said full circle and it
And it blipped. Okay, so I said it came full circle at the Canadian Dermatology Association, where I gave a plenary session on skin of color dermatology in Canada, and where we, come in the last 7 years. So it was, it's been quite a journey. There's been a whole lot in terms of research, mentorship. There's a number of scholarships, because, and this kind of speaks to your, I would say, journey more broadly. It's important to have mentorship, because I know whether folks here are in the pre-medical stage or early in medical school, I think, mentorship can be important in your journey, and certainly it was important in my journey, and that's played a role. So Yvette was one of my mentors, so that's kind of a little bit of how, starting early in medical school, that this was my idea, and then now in 2024, it's kind of come to fruition, kind of culminating in that major lecture a couple of months ago.
oh, no, that's wonderful. And I mean, and also congratulations on your recent award. I saw that on LinkedIn too. So congratulations. Um, now, so we can, this is, all to celebrate, right? Like this journey where you had this vision on doing skin of color. Dr. Yvette Miller, Dr. Miller has done so much work as a Black woman and physician and dermatologist to mentor others. But I wonder if we can talk about challenges, specific challenges that you might have faced, especially since you had a very, different vision or a new vision to bring to Canada. I know for myself as a public health physician, so I do family medicine and public health, but when I said I wanted to focus on Black health back in the day, um, there were people who were champions and who were like, okay, that's really cool. What is that? What is, you know what I mean? Like, what is that going to look
Mhm,
like when
mhm,
we're talking
mhm.
about population health? Because it didn't really exist here in Canada. But there were people who discouraged me and were like, that's not real medicine, or there's no racism here, or it's unnecessary. And so I had to push through that, and I had to make sure that my mission voice was louder than my imposter syndrome voice. Um, did you have anything like that when you had that vision, or was it kind of like, people in derm were just like, you know what, it's needed, we see it, let's do it. But did you have any challenges that you had to push through in pursuing ethnic dermatology or skin of color dermatology?
I mean, I think, there are always a few challenges. So, like you said, some people say, is this enough of an area that deserves its own niche or deserves attention? And shouldn't every skin type have equal research and emphasis? Folks wondered where, in Newfoundland, are there many people with various skin types? And they wondered, isn't every dermatologist skin of color? Because patients with skin of color all are seen, by dermatologists. So they said, is this really kind of an area of focus? So I think
Mhm.
in particular, those were some of the challenges. Like, is this something that deserves its own area?
Yeah, is it
So yeah,
valid? And sometimes those
exactly. Is
questions
it
get
valid? That's a good summary.
outdated. Yeah, yeah,
Yeah,
yeah. So how
yeah.
did
So
you
that was the biggest challenge. Yeah.
and how did you like, what did you do when people asked you those questions, or how did you come back internally? Sometimes you can answer and say, yes, it is, but you go home and you reflect and say, you know, how did
Hmm.
you push through that?
Well, again, I mean, part of it was because where I have a sociology major, and I've, studied, racism and society and culture, et cetera. So I have certainly more of it, even from a young age, kind of an academic background. I also have a lived experience in, the importance of creating, space in an area where people don't necessarily, have the same cultural history or identity, don't look like you, et cetera. So, and I'm just kind of strong-willed and determined in general.
Yeah.
So I had, I had the conviction to push forward. I was lucky in some ways in kind of proactively identifying some mentors, some in the US, connected with Susan
Mhm.
Taylor, some in the UK, Dr. Ophelia Dadsey. We talked about folks, other parts of Canada, like Yvette and Marissa. So part of it was just kind of believing in your vision and finding folks to support it. And so I found that was, yeah, I think that was kind of what kept me going. And then eventually, as I mentioned, you find some kind of momentum.
Yeah.
Fortunately, there were other folks in other areas that were kind of contemporaneously doing some work in this area, and I was able to connect with them. And it's interesting looking back, because now it's very, very well established. I mean, there's
Yes.
entire sections of there's conferences or sections of sorry, there's textbooks, sections of conferences dedicated to skin of color. So it's pretty well established now, but certainly not at the time going through. So it's finding someone that kind of shares your vision. They don't necessarily need to be at your location. Trying
Yes,
to find
that's
it
true.
as mentor or a sponsor, and really using and believing in your lived experience. Because even though I wasn't, as a medical student, of course I wasn't an expert in dermatology, I was an expert in my lived experience, and in knowing that areas in health and that haven't been focused on. Part of the reason that we think is an important niche, that those were the same kind of voices that created the textbooks, where
Right.
you don't have folks with dark skin in the textbook. So it's just kind of um, you know uh, believing in a world and educational system where things can be different.
Yeah, no, believing in yourself, believing in the vision, having the mentorship, is key. Yes, we're almost halfway through, so we do want the questions. Please put your questions in the chat. I have to say, so um, I get like DMs from people or calls where people are looking for Black physicians, largely because of my work with the Black Physicians Association of Ontario and my social media work. And I would say the two areas where I get the most calls are obstetrics and gynecology, like when Black women are
Mhm,
pregnant and they're really
mhm,
worried about their outcomes and their babies' outcomes in our healthcare system due to systemic racism and biases. But the second one is dermatology,
mhm,
right? Because
mhm,
so many dermatologists do not have the education around skin of color. And maybe even if they went to one or two conferences, you know what I mean? They might not have the
mhm,
comfort level and that type of thing. So that brings me to my next question. I mean, again, there's folks like yourself in this field of, ethno-racial dermatology, but all dermatologists need to know this at some
mhm,
point.
mhm,
So what should the field of dermatology be doing like differently? Since you have again these like historically underserved melanin rich populations who need care. What do you think needs to be done or what's happening? Maybe I don't even know. Maybe it's already happening. So
Well, yeah, well, I would say that, so the first point is that most dermatologic care, of course, is provided by family physicians and not dermatologists, because, family physicians outnumber us, probably 80 to 1 or so. So even though we only see patients with dermatologic complaints, dermatology complaints are so common in family medicine. Probably 70% of dermatologic care, 75 is done by family doctors. So we're certainly grateful for my family medicine specialist colleagues. But in general, I think it's important. I'll just briefly go through, I guess, kind of some examples of skin color dermatology. So
Mhm.
one is, some diseases just look different in darker skin. So eczema and psoriasis are very common. The textbook defined them as a red scaly rash. In my
Yeah,
skin, is not red. It's actually purple or gray or darker brown. So if you're looking for a red scaly rash, you're never ever going to be able to diagnose it
yeah.
in someone dark skin, because of course my
Good
pigment
luck.
is darker. My pigment is darker than the redness. That's the long and the short of it. Vitiligo actually is a similar prevalence. It's just that I see a lot of people with vitiligo, their skin is very, very fair. So if your skin's very, very fair and it looks white, then the difference is not a whole lot. And because it's hard to treat, a lot of folks, and this is what I learned in BC, where I did my training as well, they don't recommend treatment, especially if the, if the patient's not bothered by it a lot, just unsafe practices. Of course, if patient has my complexion or your complexion, or especially if they live or are from some other areas. I know some areas of Southeast Asia where there's a stigma with vitiligo, and it can be confused with other disorders with lighter skin like leprosy. It's just a huge difference. So the
Right.
same disease can have
Just so people
way
remember,
bigger
vitiligo is
morbidity.
where you have those discolorations that where you pigmentation.
Yes, that's
Yeah.
right. That's right. Yeah, yeah. Just light skin, kind of Michael Jackson. So the same disease can have huge differences in morbidity in people with different skin types. Another one is side effects. So folks with darker skin, hyperpigmentation, skin can get really, really dark really quickly from even some mild acne. So a lot of folks, we might accelerate the treatment of acne quicker to avoid the pigmentation, which looks worse than the acne itself. And then
Wow.
the last part is kind of cultural factors, right? So some people can have hair loss or alopecia from the way they style their hair, whether it's braiding the hair, or whether it's or headgear. Wearing turbans can cause traction alopecia as well. So you
Mhm.
need to be able to know the causes and to be able to counsel it. I remember going to some meetings and some, yeah. So Renee Beach is a hair expert, and she was talking about this is how often women should wash their hair, and this is the regimen. And then someone said, I feel very, very uncomfortable giving that advice. This is an elderly white man. And, we can understand, but that's why we've kind of been, teaching and lecturing in all the conferences. So people do feel comfortable, because just to your point, everyone should be able to treat skin disease in people of all skin types.
Perfect. Yes, exactly, exactly. And I'm going to take this back. We'll talk offline about like the family doctor piece, right?
Mhm.
Because I think I didn't realize it was 75%,
It's a lot.
being treated. So we need dermatologists to know skin of color, but we certainly need all of the family doctors too as well. So that might be a nice little offline discussion. But
Hmm, hmm.
online, my goodness, the questions are coming in. So
Okay. Okay.
that's why I have to go offline
Okay.
with you for other things because
Okay.
come on, Ani. Okay. Or Dr. O, shall I say. So I'm gonna go with YouTube first because that came in
Okay.
first, and then we've got some
Okay.
questions on Instagram, and there was lots of love on Instagram.
Okay.
So YouTube first, because that one came up first. So Yursky, sorry if I pronounce your name incorrectly, I'm trying. Yursky said, is there a reason for so few Black dermatologists in Canada? And then said, love healthcaring differently, by the way. Thank you. Now I pass the mic over to you.
Well, it's multifactorial. I will say that there are a lot in training. There's, yeah, there's at least four,
Okay.
and I've mentored two of them. So there's at least four. There may be more there in training. So I think the number is going to double within the next 5 years or so, which is great.
Yeah.
I think there are a few, dermatology, of course, is a competitive field in Canada and in the US. And as I mentioned before, mentorship helps a lot in many endeavors, certainly in medicine and other kind of competitive fields. So I think that is an aspect. I mean, certainly we can look for mentors of all different backgrounds, but I think that would be a factor. But I do think that the number is going to change a lot. We're going to get pretty close to our our certainly our representation in medicine, although Black folks are also underrepresented in medicine
In medicine in general.
overall. So I think that would be the first reason.
Yeah.
And then we're secondly underrepresented in this competitive field, and that's the exact same thing we find in the US as well.
Yeah. And you know me, I talk the tings. So I'm going to say the
Mhm.
tings. So it's not just the history and the fact that it's competitive, but we are underrepresented in medicine because of the legacy of anti Black history, the explicit policies, like historically, that were at universities like Queen's University, but also the implicit ways in which, either being able to afford the MCAT, being able to have access to mentorship, poverty is racialized in this country and is a
Mhm.
barrier for anybody, not just to pay for medical school, but to be able to volunteer and do all of the things that qualify you for medical school. What is beautiful is that across the country, there are so many programs that have come up, pathway programs, and Dr. Ogunyemi, you've been part of that, to level the playing field and to make sure that Indigenous students, Black students, Filipino, low income, like people from various different underrepresented groups can enter the field of medicine. Once you have more people in the field of medicine, then we start to see, okay, the different specialties recognize that as well. But for decades, not many of us were in the building, period, right? So you can't really have a specialty where there's a large number of us if we weren't really in the building. And that's not because of our ability, but because of so many barriers that existed. Some still exist, but a lot of them have been knocked down because of those who came before us and because of phenomenal work that folks like you have done, Dr. Ogunyemi. So I want to put that out there. So things are changing, but there were barriers, and that's why you didn't see us.
Exactly.
Did you? I talked to things, but
That's right. Yeah, no, that's you can't. It's hard to follow. But any, so we'll take the next question. I guess we'll keep going.
yes. Okay, we have a
Keep
couple.
going.
So we have Christy.
Okay.
Christy asks, what personal experiences drew you to medicine in general?
Well, yeah, my dad's a physician, actually. My dad's a professor of neurology. So I think I kind of knew from a young age that, he liked his job, took it very seriously. A lot of people, kind of recognize the great work he's done. So I always considered health related fields and medicine from an early age. But I like to challenge. I really like the social aspect, to be able to help folks, and I like the scientific aspect as well. So, and yeah, I just find it has a whole lot, and I'm interested in teaching. I know Dr. Norum is, of course, an expert in health education, but I'm interested in teaching as well. So I just find it has everything in that way. So kind of I kind of had a little bit of an inkling that it was a good career, and then as I looked more into it, I said, "Oh, this is great. It has a bit of all the things that I want." So
Yeah. No, it's a fantastic career. And can I tell you, I was nervous putting on my makeup today because I was like, we're talking about skin. I'm talking to a dermatologist. I'm like, how would you? Okay, but we'll go to the next question.
I'm off. Yeah.
Okay, so the next question is from Sita, who says, "Is there a registry with Black dermatologists?" Which is funny because there's always
I
like
know we just listed most of us.
I don't know if
I
that's
will.
a registry, but still.
No, there's no registry. There's Canadian Dermatology Association does have a registry of members. Black Physicians of Canada, I think some of us will be members of that organization as well. So that's the thing. It's kind of unofficial. I've had people reach out to me on social media, and if I'll refer them to the closest Black dermatologist in Canada based on their province. But yeah, there's no official registry that I know of.
Yeah, and actually, can I ask a follow-up question? Because that
Mhm,
question depends on what a person is looking for. If you're looking
mhm,
clinically, then you might not need a Black dermatologist. What you need is a dermatologist who's competent with skin of color. And so,
mhm,
Dr. Gunyemi, I don't know if you can speak to that. Like, is there a way to know which dermatologists, you know what I mean, are involved in that or
mhm,
look up an association? And then there's looking for mentors. And again, mentors might look like you, but given the small numbers, you also want to make sure that you're able to identify allies who do not look like you, who can also support you in your journey. So, depending on why you're looking for the registry, Sita, I don't know
mhm,
if it's
mhm.
because you need from a patient perspective or you're looking at it as a student, but you definitely want to consider beyond folks who look like us because we're so underrepresented. So, Dr. Gunyemi, can you speak about both ends? Like, if somebody's the competency they're looking for is skin of color, or the competency they're looking for is somebody who's going to have an equity lens in their mentorship.
That's right. I mean, I think you pretty much summarized it. So if it's yeah, I guess if you're looking from a patient point of view, then fortunately more people I think are versed in skin of color dermatology, and at the very least, I think they're realizing that there are a lot of considerations in counseling patients and treatments that they didn't consider. So I think they're kind of more patient centered and more. It's humbling in that way, right? Because patients will be an expert in their skin types or how their skin reacts to certain treatments or which hair styles and or hair products are unacceptable to them. So people are humbled because they realize that that is an area where the patient, is certainly the expert in. So I do think that, fortunately, even if it's not a Black dermatologist or a dermatologist of color, the baseline competency, we'll say cultural competency, in all dermatologists is way more than it has been over the last 5 or 10 years.
Oh, good.
Yeah.
Okay. And when it comes to folks who are involved in like dermatology and allyship, are there
In
certain
allyship,
programs?
yeah. I mean, I would say that certainly yeah. I mean, different groups. I know Black Physicians of Canada would be a group to reach out to. Indigenous Physician Associations of Canada would be one to reach out to as well. There's only one Indigenous dermatologist in Canada. So those would be, yeah. So those would be some groups to reach out to. I mean, certainly, reaching out to the university, people usually get directed to me pretty quickly when they reach out to the university. But but like you were saying, I think certainly, folks, I find that, folks, if they're, part of one historically excluded group, then they, on balance, can understand at least, some aspects of
Mhm.
other historically excluded groups. So that's important. And sometimes it is important to actually have, allies and mentors from people with different lived experiences, right?
Yes.
So from a mentorship point of view, that's something to consider as well.
Yeah. All of the things. Find all of the help and all of the people. Okay. We are at 7:30, but as usual, it's like it's towards the end that the questions start ringing in. So I have to do a check-in with you.
Mhm.
There's two more on the docket. At 7:30 ET. Do you have a few more minutes?
Oh, I got lots of time.
Okay.
Yeah. Oh, yeah, I got lots of
Love
time.
it. Okay, see,
Yeah.
and that's the thing with different careers and things, it really depends on, lifestyle. And so, yeah, sometimes the surgeons they gotta go.
That's right.
So,
Yeah,
okay.
that's right.
So I'm glad that you can hang on. And yeah, I'm public health. We got time. We're good.
That's
Okay. We can chat. Okay, so Pumpkinelli or Pomicanelli, um, Pumpkinel, asked, why are Black people so prone to keloids?
So yeah, and so keloids are kind of a process of scarring that's kind of gone overboard. So certainly after an injury, it's important that collagen production increases. To collagen is like a protein involved in repairing the skin and causing scars. So for whatever reason, that we have a different proportion of collagen of people with different backgrounds, so it gets overly active. So instead of just repairing the scar, it goes overly active, and increases, causes some inflammation, and can get quite thick. So in general, it's just a higher proportion of the genes that cause this protein of collagen are just more common in folks with African background.
Oh, but what about other like melanin rich groups? Is it really like largely Black? Because I know I've seen other groups who.
Yeah, some East Asian folks can have keloids, especially I find spontaneous keloids in the chest are common in East Asian folks, and South Asian folks as
Mhm,
well. But definitely Black folks would be most common, and
mhm.
white folks would be least common, and then those other groups would be somewhere in the middle. Yeah.
Is there like now I'm asking my own question, but I'm wondering, I'm an epidemiologist, so I'm like, is there like a direct association or some sort of like best fit line between like melanin rich skin and the collagen like reaction with regards to keloids? Is there any associate? It just seems like you
Um,
described a bit of a gradient, so I was just curious.
yeah, yeah, I mean, I find a lot of disorders that tends to be the case. So one example would be skin cancer prevalence, right? Is lowest in more or less, the lighter the skin, the higher the risk of skin
Yeah,
cancer. That one is almost an exact
yeah.
gradient. Obviously depends, as you know, on different breakdowns of studies. They talk
Mhm.
about, like non-Hispanic whites. But yeah, that one is very linear. Keloids, it's similar. I would say similar to that.
Mm, okay.
Not quite as much data because they're not as common as skin cancer that we
Right.
measure. But I would say if you have those three groups, we could call that linear in a way.
I'm trying to make a best
But
fit line,
it's
but
a different, yeah, it's a different protein though,
uh,
because in skin cancer it makes sense because melanin is the
yeah,
same protein, right? That
yeah,
causes skin color and protects from skin cancer. So that's why that's an exact
yeah.
line. And collagen is not quite the same, but
Okay.
it's a bit of a relationship like that.
Okay, okay. So there's a direct association. Sorry, guys, I'm nerding out. It's the epi
Mhm.
in me. Okay, back to your questions though. So, and then Christy asks, I don't know if you're comfortable saying this, but it's probably public-ish. Christy asks, "What is your dad's name? I'm looking to specialize in neurology one day."
Oh, okay. Yeah. So same last name. His first name's Abayomi, Abayomi. Yeah, it's it's all over the internet.
Yeah, I figured.
Yeah, and that's great. I mean, he'll be retiring in a few years, so you can replace
Hey,
him.
I
And
know
yeah, you can.
time
Yeah,
to give advice. All right.
that's right.
All right. And question from Martin. So this might be the last question at 7:35. If anybody else has questions, please do put them in now. Otherwise, this will be our last question. So from Martin, Martin said, "You said dermatology is a competitive field. What steps should I take early on to have a greater chance of at becoming a dermatologist?" Now, Martin, we don't know what stage of the medical or healthcare education journey you're on. So, Dr. Ogunyemi, can you maybe map out things, assuming pre-medical, medical, and
Yeah.
then trying to,
Okay.
what are the steps?
Yeah, I will pre-medical. The big thing is getting into medical school. So which I know I suspect you've talked about before. So it's certainly, EB grades, just general experience, extracurricular activities. Those things would be important. MCAT at some schools.
Yes, but
Um,
it's important to say, okay, if you're thinking about dermatology, you don't have to be worried at the pre-medical stage about doing
that's right.
research in dermatology right away. Is that basically?
No, no, no. You're just going to
Okay.
get into medicine, and it's good. It's good to have an open mind of other specialties. There's lots of other specialties out there, as I mentioned. Um, family doctors will see a lot of dermatology. Some surgeons, rheumatology have a lot of overlap. But in general, I would say that the steps are the steps for other specialties. Once you get into medicine, it's just being a good doctor first, right? So a good dermatologist is a good physician first. So certainly you want to, pay attention in classes. I think clerkship rotations are very important because that's when you put it into practice. Certainly, medicine, family medicine, pediatrics are very relevant to dermatology. A lot of folks will do research. It tends to be, you've heard of the conversation we've had already. It tends to be pretty academic. So a lot of folks will do research in the first few years, and try to find a mentor and do some research with a mentor in dermatology or in related fields. You could have, oncology is related. Someone mentioned lupus here, rheumatology is related. So those things are all important, but definitely want to be a strong pre-medical applicant and strong medical student first, because before you're, looking at dermatology in particular.
Yes. And I think I mean, that question, so we got one more question. We'll take it. But that question, kind of links with the final question I was going to ask you anyways, which is like, what advice do you have for somebody who's early in their journey? So I think as far as like what to do if you want to be a dermatologist, you've answered that. I'm going to push it a little bit more and say, okay, whether somebody wants to do dermatology or they don't want to do dermatology, you decided to kind of carve out your own path. So, any advice that you have to a student who has a dream about doing so, like really health caring differently, like bringing
Mhm.
their different experience into their field, and they're early in their journey? Anything that you would add to what you already added to, you know what I mean? That pathway of the standard pieces that one needs to do. But what if you have that fire in your heart?
Yeah, I mean, I think it's important to take a broad overview. I think probably the simplest way to do it is, I think it's definitely important to, see patients. You see whatever 40-45 patients a day, but what about the patients you're not seeing? What about the people that can't see you, that don't have a home, don't have a car, live 4 hours away? How are they getting care? Because you need to think about not just people you're seeing, people you're not seeing, and how you're going to help them.
Mm,
Right? So there's more to being a doctor than working in a hospital, working in a clinic. So you need to get involved in health systems, having people to have access to care, setting up systems so people in rural areas can have care as well. That includes virtual care, making sure virtual care is equitable. So we're closing the gaps instead of just making it easier for people who already have improved healthcare. So you need to think is kind of outside of what's in front of you. And for me, that's what really inspires a lot of my policy work. Canadian Doctors for Medicare. I was lead author of a equity and virtual care policy, advised the federal government in distribution of vaccines at the height of the pandemic in 2021. So you really need to think about not just the people in front of you, of course, that's kind of I think the minimum being a physician, but about what about the people that can't see you, try to prevent people from needing to see you in the future. So it's important just to think kind of outside of the box. And how does your experience and your background lend itself to thinking that type of way? So in the systems level, and at an overall provincial or national, even international kind of policy level, besides, because there's always going to be a room full of patients to see us because there's a doctor
Yes.
shortage,
Yeah.
but you need to think about the people that aren't seeing you as well.
Yes. No, I love that. So medicine is, of course, what happens in clinic, but you also need to look beyond the four walls. And I think where you see disparities, then doing the pieces that Dr. Ogunyemi had said about thinking about system change. So whatever it is in your heart, that fire, don't forget about the system change that's required to move things beyond whatever prescription you could write in the clinic. So I love that, Dr. Ogunyemi. Now we have a question. I'm going to flip it because, health caring differently is about taking a path and a career in healthcare. We don't focus on specific like diagnoses kind of questions, but I'm going to land this plane in a way. So we did get a question. I don't know who asked it, but we got a question that is asking about systemic lupus erythematosus, which I barely can pronounce anymore. SLE is what we end up saying, right? Like
Yes, yes, yes.
so SLE, lupus. I think that this question about, how do we diagnose it or how do we know about the diagnosis? Obviously, one needs to go to their primary care physician and then have a referral. But sometimes referrals take a long time. So I feel like the bigger question here, because many of you who are students and interested in health sciences, if you're coming from underrepresented communities, underserved communities, when the community knows that you're that person, you might get questions like, how do I know this? How do I know that? And what I found when I was an early medical student, I would tell people, okay, you know what, this website is a good place to go look for health information. So, Bolu, Dr. Ogunyemi,
Mhm.
let me ask, when it comes to dermatology, of course, you want to see a doctor, but Dr. Google can give a lot of random information. So, are there any public websites or accessible websites where people can learn about different skin conditions so that they can empower themselves as patients and our listeners can empower their families to be able to like look things up on a trusted website? Is there any trusted websites that you know of when it comes to dermatology?
Yeah, when I went through the like DermNet New Zealand, it's a bit dated now, but they had information that was vetted. I
Hmm.
think another useful site is the British Association for Dermatologists. So they list a number of common diseases and actually a lot of treatments and the side effects. So I actually print the diseases. I of course explain to my patients, but for the treatments, I'll print them and give it to the patients because a lot of patients will forget information once they leave the office. So yeah, so British Association for Dermatology, BAD. It's like patient information leaflets or like PDFs. It's easy to
Yeah.
anyway to print, etc. And then DermNet New Zealand is a bit aged versus the British one is updated because of course like any field, new medications, etc. So I think those would be some useful points. So again, Dr. Miller Monfort is spearheading is going to be a national kind of gallery of skin of color dermatology in particular because we talked about the textbooks don't have us represented as
Yeah.
much as they should, so we need to kind of update this with a kind of a gallery that's available online, and it should be
Oh, to
publicly
the public?
available as well.
Do you know
Yeah,
what it's
yeah,
going to be
so
called
that's
or what
that's
people
in the works.
do you know, like, what should people I know it's not ready, but what should people Google to be able to find this gallery?
um I
Search its
don't know,
name
I think
or the association? Like, how would people find it? And when it comes,
or like an atlas. I know there is a right now there is I can get it for you. It's just not handy, but I know there is
okay.
an atlas that you don't need to be like a physician to get.
Okay.
Um, I can I
You
can
can
get
get
it
it for us
for
after.
you.
You'll
Yeah,
see
just
we'll put it
but
out.
more or less you're
Put it
looking
out by
like the
We can put
full.
it out by
Okay.
social media and well, these are the things we put in our newsletter. So everybody make sure you sign up for the newsletter.
Mhm.
And we'll make that information because it's hard for people to catch all of the things when we're just talking. This is more for
Yeah.
inspiration, but
Yeah.
information happens on with our monthly newsletter. So if you can send us, we'll follow up with you. I know you're busy, but we'll follow up with
For
you
sure, for sure. You're fine. Yeah.
and we'll put it out so everybody has it. Because I think really, I don't want on this program for us to get kind of caught up with diagnoses and that kind of thing. That
Yes.
you have to go through your
Yes.
doctor. But
Yeah.
absolutely, you said it. There's a doctor shortage. So
Yeah.
where as many folks can empower themselves with valid information, and
Yeah.
you can start to play that role in your families if you're playing it already. We want to empower you to be able to do that, right?
For sure. For
So
sure.
okay, great, great. Dr. Ogunyemi, do you have any other things that you want to say before we wrap up? Any advice or how people can reach you? Just anything.
Not a whole lot in terms of parting words. So certainly, yeah, we talked about thinking outside the four walls. I think try not to discount your lived experiences because that can be important. Mentorship and sponsorship is important. It's also important to teach. As you progress. So as you go from pre med to med to kind of senior medical student and residents, etc. It's important to teach and mentor other folks because you learn a lot when you teach, right?
It's true.
Is a good chance to reflect, to pass things on. So I think that's important as well. And then lastly, I think the goal is whether we talk about social accountability or diversity and skin tones and skin types and EDI, et cetera, it's not supposed to be something you kind of think of separately from medicine or learning or dermatology. It should
Mhm.
be integrated, right? And integrated in our approach to a patient, and not just the medical, but there's the social aspects, approach to teaching, etc. So I hope that there will be a day where all this is integrated within our overall approaches, and I think that we're kind of going in the right direction, which is great to see.
Oh, fantastic. And I just really love the work that you do. It is like you have no idea how the ripple effect hits. I remember when you published in the New York Times. I don't think I even knew you personally then,
Mhm.
but it just had this huge like wow, right? You were a resident at the time.
I was a resident. Yeah,
Yeah.
yeah,
So
yeah.
I remember, and all of us were like, "Wow, okay, fire! Like this is so inspiring." So keep doing the amazing things that you're doing. Thank you for joining us today, Dr. Ogunyemi. We appreciate you, and we look forward to those resources. For
Mhm.
everyone, please next week, please join us again. So I'm going to be having tea time. It's going to be more casual, more chill with Cassandra Coyle. She is the president of the Black Medical Students Association of Canada, and we'll be talking about the importance of student research opportunities and her experiences with that and what the BMSAC will be doing. But overall, thank you for watching. Follow us on social media and sign up for that newsletter. Let's have those resources that Dr. Ogunyemi is going to provide so we can get that to you. And otherwise, I will see you next Tuesday at 7 p.m. Eastern Time on Instagram Live, YouTube Live, and LinkedIn Live. Thank you, everyone. Have a good night.